And that debate over returning to the classroom comes amid that concern over the spread of those two variants across parts of the country. I spoke earlier with Dr. Imran Ali. Dr. Ali, a new study finds cases of the UK variant could be doubling in the U.S. every 10 days. How concerning is that?
Well, Kenneth, this is really concerning because, although the data is still preliminary, hasn't been peer reviewed, it does show that we have likely more of the variants floating around in our population. We haven't been doing the genomic sequencing that robustly as other countries have been doing, and that could explain why we may still see some more surges in the future.
And Doctor, this week the Biden administration is expected to issue guidance on reopening schools. It comes after the CDC last week said teachers don't have to be vaccinated to safely reopen schools. What are your thoughts on the confusion teachers and parents are facing regarding safety?
Yeah, I'm getting a lot of questions about this. And, we do have some data that shows, well, kids are less likely to spread the virus to adults. But, that gets all changed with these new variants. We don't really understand how these variants work. And it's very important to understand, at least in the medical community, we're not getting infected from our patients. We're getting infected from our unvaccinated colleagues. So unless we can get teachers vaccinated and the schools ready to, really keep that social distancing, I'm not quite sure if we really, have all the information that we need to know before we can really start opening schools widely. But we really do want to open schools nonetheless.
Dr. Ali, thank you.
Thank you, Kenneth.